a question now. If you are, a lot of people are telling you now you have to wear a mask. Okay, so why? Because they say that epidemiologists found that the risk of infecting or the risk of COVID infection is way much higher in those who do not wear masks. So when they compare two groups, the probability of infection in one group versus the probability of infection in another group, they found out that it's much, much, much higher when you do not wear a mask. And that's why they came up with the recommendation, if you are in a group of people, you know, in a social gathering, or whenever you are surrounded by people, then it's recommended that you wear a mask. Now, this is a very important study, especially at a pandemic like that. So how do we apply the statistics that we've learned into medicine? And that's when epidemiology come to life. Inshallah, next year, we will continue our discussion about epidemiology. But this time I want to introduce the topic so you can get a feel of what epidemiology is all about. Okay? All right. Now, remember we studied the probability of an event in one group. What is the probability of me having an A in biostatistics? What's the probability of this person dying at this age? What's the probability of being cured from cancer at certain age? Those are probabilities in one person, one group, and we did not compare anything. Now somebody says, wait a minute, we need to compare in medicine to know that group A, the group that wear masks, those individuals are more protected than those who do not. And how do we know that? We compare the incidence of infection in the two groups. So from now on, we need to apply the principles of probability and statistics in two groups. And remember, Dr. Peter started with comparing two means and comparing multiple means, more than two means. So if you compare two means, you said, I'm doing t-test. If you're comparing several means, you're doing analysis of variance, which means you're comparing the variability between group and within group. And then you say if the variability between group greater than within group, then the F value is so and so, and then that's what you did before. It's all comparison between groups. And then the F, if you get the significant, it'll tell you one of these groups is different than the other group. You don't know until you do other tests. So now we want to continue this and now give it different names. Go back to now being in medicine. Remember that we are medical students. So we want to talk about the probability, not of grade A and grade B and who got A or got, no. We want to talk about disease now. We want to talk about medicine. So we have two main measures in medicine to compare the risks of having a disease in two groups. So to compare the risk, we have two different measures. One measure, we call it the relative risk, RR, relative risk. Some people call it risk ratio. So it's the same exactly, different names for the same entity. And then odds ratio, it's another measure for comparing the disease in two groups. Remember, we're comparing the probability of disease in two groups. Now, so this is now an introduction. We're talking about two groups, and we have two measures. Remember those names, relative risk or risk ratio or odds ratio, okay? Now, relative risk, I also am repeating the same thing, risk ratio. So when you read it in different books or different references, you don't get confused. They are the same thing. Now, relative risk describes, this is a definition now. What's the likelihood? Likelihood meaning the probability, but we give it different name because the probability is the likelihood. How likely is this to happen? How likely is infection to happen? You see, how likely? So the likelihood of developing a disease, how likely is to have an infection in group 1 exposed group. What do I mean by exposed group? The group that did not wear a mask and exposed themselves directly to the virus, compared to non-exposed group, the group that protected themselves with a mask. Okay, so what is the describe the like? So we want to see where is, in which of these two groups the likelihood of having a disease is higher. That's the whole. So that's what we call it relative risk. Risk in the exposed group versus the risk in the unexposed group. We're just comparing these two risks. So relative risk is the ratio of risk. That's what the name risk ratio. It's the ratio of two risks. And remember, I want you to remember when we talked about ratio versus rate versus percentage, please remember those. You need to know what's the difference between rate and ratio. You don't confuse them. They are completely different, okay? Now, so the ratio now here is not the rate, the ratio of risk. So relative risk is the ratio of the risk, meaning probability. Again, risk, meaning probability. You can say risk, you can say probability. Those are completely comparable names. You can use this or this, okay? Of disease among the exposed group, I'm going to call it P, mean probability, and E, little e, exposed, to just make sure that you understand the terminology. To the risk of disease among unexposed group, U, E, unexposed group, okay? So this is the relative risk. It's the ratio of two risks or two probabilities. Probability of disease in the exposed, but the probability of disease in the unexposed. Is that clear? Okay, please stop me. I mean, at any time, stop me. Don't send anything on the chat. Chat with me directly, please. Now, question, how do you calculate this simple? The idea is very simple. All what we're doing is taking the ratio of the probability of disease or risk of disease in one group versus the other group, in the exposed group or the unexposed group. That's it. So it's very simple concept. But how do you calculate it? Okay, let's use the 2 by 2 table. You know what the 2 by 2 table is? 2 by 2, 2 items on the top and 2 items on the side. Disease, no disease. Exposure, no exposure. Okay, so this is the 2 by 2. 2 items, 2 outcomes, 2 events versus 2 events. So what is the situation here? I have 2 groups, group 1 and group 2. The group 1 is the exposed group. Which group the exposed? The one they do not wear a mask. No exposure, they actually protect themselves with a mask. Now, the exposed group, some of them